Guys, Josh here. Welcome back to our treatment for swimmers series. We've got Ninja down on the table. We're doing some adductor work again for that breaststroke kick. So when we're doing our breaststroke kick, we're not coming all the way out here and squeezing, but these adductors are always turned on. So we bend our knee up and then we really snap that kick back. So in that motion, that adductor, that squeeze, that adductor's being turned on. Come have a look at this, Leo. This is our adductor complex here. So you can see where it attaches right up to that pubic bone, and all these different attachments here, all down the femur there. So all these white bits, where there's less blood flow, they're important. All these white bits up here, they're important too. So let's get into it. Let's get into Ninja. How are your adductors feeling, mate? We'll do a bit of testing actually. Yeah. Let's see what we can see what his ranges are like. So we'll get him to come this way. That's actually not too bad there, Ninj. How's it feel? Yeah. Feel any pulling, any tugging anywhere?
A little stretch there.
A little stretch through that area.
So DOMs from squats.
DOMs from squats. We did do some pretty heavy squats on Monday night in Gully for our lift club.
Yep.
So
feeling good though, huh?
Yeah, we are. We're doing pretty well. We're doing pretty well. Week 2 of the block.
No, week 3.
Week 3 of the block.
We're on to our sets of 3s.
Yeah.
So strength.
Just come in here, and we're starting right at that distal end, and we're just going to do a nice glide up with that pisiform bone of the palm. Follow that line all the way up that adductor, finding any little nuggets along the way. With this sort of stuff, we don't want too much wax on there. We don't want to be slipping and sliding too much. Just enough that we're not giving him a friction burn.
It's all good. You can affect the fascia. It's the important thing.
Get that good deep connection and glide all the way up that line. Just a sort of opening stroke, just to allow the body to realise we're getting some treatment here. Sometimes, if we were short for time, you can go straight in with an elbow and dig in, but sometimes it is good just to let the body be aware that this is what we're doing. Let the body melt into it and soften. Just tracing that line. As you saw in that diagram, there's all these different adductor muscles. Some are really, really big. Some are a lot more skinnier and strap-like muscles. And so we're gonna try and affect some change here on Ninja so he can do a better breaststroke kick.
Yeah, that's what it's all about.
The Olympic Games have just been and gone, but the Paralympics are on at the moment, so tell you what, some of those athletes are rather incredible. You see people with missing limbs or recovering from traumatic brain injuries and all that sort of stuff, and some of these athletes are phenomenal in what they do. I feel like my background in swimming was hard enough, and I've got an able body. These people have got physical disabilities and things that for a lot of people would stop them from doing that sort of stuff. But these people are incredible athletes just to watch. So we should really be supporting our Paralympic athletes. They're phenomenal. How's that feeling there, Nin?
Yeah, good, man.
Good. Yeah, coming in, bit of a forearm, bit more of an elbow point as well in that area. Had Das actually, we had our workshop this morning. Das did this on me and I needed it. Breaststroke was my stroke, and there's a lot of repetitions of breaststroke kick in there that I've done over the years of swimming. So I needed it. Now that we've sort of got into that level, we can change that pitch of angle and come in a bit more with that point. You can see I'm giving you a bit of curry. There's a little bit of a grimace forming on Ninja's face.
Just trying to move and groove with you, man, and
That's good.
tune in and allow you in.
And obviously this area on a lot of people is sensitive area, genitalia and all that sort of stuff. We acknowledge that, but if someone's got pain there, do we avoid it? No, we go there.
It's an important area for human function, movement.
Oh, even for you, you do a lot of sprints as well.
Yeah.
Sprinting, this muscle in particular, particularly adductor magnus. Adductor magnus is one of the muscles that it actually does contradictory actions. It flexes and extends the hip.
Mm-hmm.
Now, you'd think, how the hell can it do that? But it does. It's because it's where it attaches and where it is in that plane of motion. It can do opposing actions, which is phenomenal. And obviously it then also adducts, so bringing that leg back in as well. But yeah, there's some crazy muscles in there that can do some phenomenal things. Obviously then you've got brevis and longus in there. So again, adductor groups. You've also got your gracilis.
Yeah.
It also does adduction.
Gracilis is the main one people can feel in the inside there.
That long ropey one.
Yeah.
Crosses that knee joint as well. So it does a very small amount of knee flexion as well.
The anatomy's interesting, isn't it? When you kind of look at where there's attachments right along the
femur
bone as well. Yeah, so it's sort of important that we can get into that level and affect the tendons. It's where the stress is, the pulling on the bones.
Well, that's just it. It's finding where the client has that block, that barrier. And I came in today for our workshop that we did when Das was treating me, and I was saying I'm feeling tight through the outside of my hip. And we did some testing and stuff. He's gone, oh, you're really tight through your groin, and just this is where he started. And even this helped release that, because they've got that agonist-antagonist relationship. So doing this sort of work can help with people with their hip pain as well. Help them with their rotation, help them with so many different things. And it can be an overlooked muscle group. Good, Ninja. As you can tell, I'm just sort of sitting here, allowing that tissue to sort of melt, not doing anything too wild, too crazy. I can tell that it's doing something for Ninja because he's got his Zen face on. He's trying to hide his grimace, but you can tell it's there.
You get present when you do this stuff, don't you? When you're receiving.
Oh,
So
absolutely.
it's part of it. You got to feel it to heal it.
You can. That's true. You do have to feel it to heal it. You can come in with a thumb as well. You can see here that flick, that ropiness there. That is an adductor tendon. So just pinning in there. A thumb versus the elbow. It's a smaller area, but you can be more precise. So sometimes getting in there with a thumb can sink a little bit deeper into a particular spot that is causing some grief. Think of all those tendons where they all attach and just trying to promote that blood flow to that area. That's how the body heals itself, is through the blood. It's where all the nutrients, all the oxygen, it's how it gets transported, promoting that blood flow. It's why movement's medicine. Movement promotes that blood flow as well. I know Ninja's been big in the saunas as well.
Yeah.
Again, heat promotes the blood flow, dilates those blood vessels. What are you saying? You're doing about four or 5 times a week in the sauna for about 30 minutes?
30 minutes, yeah. Make sure it's preheated. I did 5 times every weekday last week, so that was good. So I'm going to try and get 5 a week for a bit. I think it's stacking on top of each other, and it makes your body more efficient and more, exposure to it. It makes you more resilient, doesn't it, to hit things, to change.
So many benefits to the use of saunas as well. I've only just started sort of incorporating it into my routine a little bit as well. But they said people that use a sauna for up to 20 minutes plus. Oh, flicked off that one. It's good. Up to 20 minutes plus 4 times a week. Their risk of heart attack goes down by 60%. That's a massive difference. Risk of stroke similar as well. So, and it's just sitting in a hot box for a bit.
Pretty easy.
Pretty easy
in a way. Yeah, infrared is different again as well.
Heats you from the inside out, doesn't it?
Yeah. To the old steam sauna when you throw on a bit of water on rocks.
Yeah, they have their benefits for sure. For muscle recovery too. So if you like Ninja, you're lifting and you're sprinting, it helps your muscles recover. Speaking of sprints, barefoot sprints on a Thursday night here in Richmond. 6 o'clock. If you're in the Richmond area, come sprint with me.
Book it in.
Been a little while since we've had sprints in Richmond. We've been doing them out of Gully on a Friday night, but we're back.
We've been waiting for someone to pass the torch on to. Yeah. Wants the gig.
Yeah.
Yeah, it's good, man.
Definitely. Come run with me. Thursday nights. Good fun. Only one rule is you have to be barefoot.
Yeah, that's the only rule. Turn up. It's the hardest bit.
And be there.
Turn up and take your shoes off. Most of the job's done in that.
We had someone come from the States last week as well. One of Mac's colleagues came down and ran with us. Jace came down as well. So myself, Jason, one of Mac's friends from the States. So she's come all this way from America to run with me. So if you're in the Richmond area, what's your excuse? Alrighty. Now coming in, just again, a bit more broad with that fist. Sinking in there. Can feel just that little bit of resistance in there as well. Really, really good. And then the other thing that we can do is, and this is something Elliot taught me the other week as well, we were doing a treatment swap on him, is we can actually get it in a bit of a flexed state as well and get those really high attachments as well this way, in this position. Again, being mindful, you don't want to slip here, but again, you can get those attachments in this position as well. The benefits of working in a place like this, you get to do treatment swaps and practice on each other, and you get to learn things from each other as well. Get Getting that thumb right into that attachment. Like I said, for the swimming community out there, this is a massive, massive group, particularly for breaststrokers, but even in people that swim the other strokes as well, butterfly, backstroke, and freestyle. Because it does flex and extend that hip, it will be getting used in all of those kicking actions. But yeah, particularly breaststroke, just because of that squeezing action that you produce. What are we feeling there, Ninja? Do you feel like there's that nugget that I'm starting to melt down?
Yep.
Yeah.
Stay on it.
Yeah. Felt something give then. Feel that next barrier now as well. Sometimes in this area too, just trying to get the client to make sure that they're breathing can be important. Holding your breath can help possibly tense these areas up, so make sure that they are breathing and taking themselves away from the pain, focusing on the breath rather than the thumb. And then making sure that when we are coming out of that area, we're slowly sinking out. We're not rushing that, because sometimes that abruptness too can cause some aggravation as well. And then we'll just do some retesting again. So take it back through there. I feel like that is getting a bit lower down to the bed now as well. So we've created some length through that range already in just that short amount of time. Now, if I was doing a full-on treatment, yeah, I'd look at hip flexor as well. I'd look at the glute, but that was just a little bit of a glimpse of how we treat the groin here at MMT. If you want to experience this for yourself, book in. We'll be happy to treat you. Thanks, guys.
Get it done.